Now I know I have a cancerous tumor in my body, and I just have to continue to live like it's not there, right? And I tell people this all the time because the surgery and the pain and the recovery and all that stuff, like that didn't bother me as much. But I had my first panic attack after that. Now, I don't know anybody listening if you've had panic attacks, but they are the worst thing. Like when I've been dealing with health, like I would have like debilitating panic attacks to where like I didn't want to go out. Like I would be so scared to like go out to dinner, like it was just bananas. So I had to work through that, and it really made me realize that, some people use substances to kind of deal with their mental health. Maybe that's why they drink beer, or maybe that's why they do drugs, or maybe that's why they do whatever. But I went through therapy. I was on, medicine for it. And I was eventually able to get back to living a normal life, but it was freaking scary.
But you had to work through the process to get there.
Have either of you had panic attacks? It's okay if not.
I don't know if I did or not. I don't think.
So anyway, anybody who's listening that's had it's just crazy. Like I had to go to the ER. I thought I was having a heart attack. So anyway, after months of kind of dealing with that, I was able to kind of get back to being able to function normally, but it was scary. And I want people listening to realize that like that's mental health, right? There's so many different mental health disorders. And a few years ago when I started on, if you haven't listened to the first episode of the podcast, I started a chemo drug called Weloreg, and it drops your hemoglobin to like 9. Most men are like 15, 16. So my red blood cells were, very low, and I would get dizzy. So because I was getting dizzy, I was like, I'm going to pass out. So if it was hot out, or if I was like, on my feet too long or whatever, I would then start getting panic attacks. So I'm like, I'm going to hit the deck. Who's here? Who's going to save me here? Right. So again, just very, very tough to deal with. So I'm telling the folks listening that we realize that mental health is a real thing. I'm actually wearing my CMSU community support walk shirt here for a reason. But yeah, listen, we all deal with tough stuff. I want people to realize that at Lauer Power, a lot of folks will deal with some sort of mental health in their life, and there's tons of help out there. Okay. So you don't need to turn to street drugs or any of those other things to try to deal with it. Let's connect you with professionals that can help you through it. If you have to get on medication or whatever, somebody that's going to help monitor that and get you the support that you need. Because if it wasn't for my family and for, my support group and my work, my team at work, I might have been, in a really rough spot. So just wanted to do that. Our leadership topic of the day was being aware of mental health and the challenges that it causes. And again, it's all just about checking on each other, being able to, have an open mind that somebody might be dealing with stuff, in their lives that makes their day-to-day a little bit more difficult than others.
I think step one is not being afraid to ask for help. Yes. A lot of people are like, I'm okay. And I think a lot of people are afraid to ask for help.
So have you seen those billboards that have said it's okay to not be okay? Have you ever seen those?
Yeah, sure.
That's the message we need to send, right? And listen, we got to take care of each other. A lot of drug use and a lot of alcoholism and a lot of struggles are there from mental health disorders. And some people, I think, just aren't aware of that.